The Michigan Bean Commission welcomes you to today's episode of the Michigan Bean Academy webinar series. We are delighted you could join us for building a foundation for closing the dietary fiber gap, improving gut health through a diverse diet, presented by Dr. Henry Thompson at Colorado State University. This is Barbara Ivins, registered dietitian, and your host for the webinar. The Michigan Bean Commission is pleased to offer this series of free accredited webinars, many with a plant-forward eating focus that cover a broad range of contemporary nutrition and food topics. Webinars are a blend of research, science, and practice to help nutrition professionals stay informed on recent developments on relevant topics. These webinars are funded as part of a current USDA grant to the Michigan Bean Commission. A few webinar logistics. Handouts of the slides presented today is available at the michiganbean.com website under the Health Professionals section, and the Continuing Education Credit Certificate will be available to download after the webinar at the same site. Our presenter will answer questions at the end of this webinar. Please submit questions by using the Q&A feature on your computer screen. We welcome today's Bean Academy faculty, Dr. Henry Thompson. Dr. Thompson is Professor, Nutrien Distinguished Scholar of Agricultural Sciences in the College of Agricultural Sciences, and Director of the Cancer Prevention Laboratory at Colorado State University in Fort Collins, Colorado. Prior to that, he was head of the Center for Nutrition in the Prevention of Disease at AMC Cancer Research Center in Denver. And before joining AMC, Dr. Thompson was on the faculty at the University of New Hampshire, where he was Professor of Nutritional Sciences and Director of the Human Nutrition Center. He served as a Senior Research Nutritionist at IIT Research Institute in Chicago. Dr. Thompson earned his PhD from Rutgers University in Nutritional Sciences with an emphasis in biochemistry. Following his doctoral work, Dr. Thompson received postdoc training in the Department of Molecular Medicine at the Mayo Clinic in Rochester, Minnesota. Today's learning objectives include, upon completion of this webinar, the participants will be able to describe what pulses are and how to properly categorize them, discuss the health benefits of pulse consumption, and explain what critical thinking is and how to use the process to develop workable solutions to health improvement via increased pulse consumption. I'll now turn the webinar over to Dr. Thompson, who will discuss filling the dietary fiber gap. Dr. Thompson, closing the dietary fiber gap.
Thank you very much, Barbara, for that introduction. And hello, everybody. Despite the fact that we are in cyberspace for this webinar, I hope to bring some excitement and enthusiasm to our gathering today in talking about something that I think has really captured people's attention, and that is the role of gut health and a diverse diet in promoting human health. And I want to get you to think about something that I think many professionals may have given up on, and that is the role of dietary fiber and the gap that exists today between what we want people to consume and how much they actually eat in terms of promoting human health. And in order to do that, as Barbara already mentioned, we have a couple learning objectives, and I've twisted them around just a little bit from what she mentioned, because I want you to work with me such that we can understand and take critical thinking and apply it to the problem that's been presented. How would we use dietary fiber and gut health to improve human health? So in doing that, we will First, consider what critical thinking is, and then describe a framework for considering plant food diversity in our diets. That's your diet, my diet, and our client's diet. And then we're going to explore the role of pulses in that matrix of opportunity. What are pulses? And whether there are potential health benefits. So we'll do that in the next, say 40 minutes or so. So hang on to your seat, and here we go. I'm all about building toolkits while providing content or information. And one of the things that I judge is really valuable today is to ask people to take a second and say, for a topic like what we're talking about, dietary diversity, gut health, human health, and wellness, to say, okay, maybe we've been doing an okay job, but we can do a better job. But if we're going to do a better job, we got to do this. We got to get folks to think outside the box. And I like to turn people's neurons on. And so let me turn on your neurons. What is this picture of? He said something about getting you to think outside of the box. Well, I actually just put you guys into a mailbox. This is you in a mailbox, looking from the inside out as someone who delivers a letter to the post office. So that's setting the stage for us to think about critical thinking. How many times in the past couple of years has somebody said, we need to improve our critical thinking skills? Have you ever stopped to ask yourself, what is critical thinking? Allow me to provide a definition of critical thinking and to introduce you to the person that got me to think about what critical thinking is and how you improve it, and that's Derek Cabrera. And if you want a wonderful, quick YouTube watch, I provided a link to one of Derek Cabrera's talks, and I'll share with you his definition in a second. But I just want to point out to you that if you want to quickly understand critical thinking, I purposely went to Google, Wikipedia, and took the little blurb that they have on critical thinking, and I pasted it in here because I want you to have a resource you can go to after this presentation. So critical thinking is simply the ability to take unstructured information, structure that information so that you can do something with it. And to improve your critical thinking skills, it has 4 components, which I will talk about in just a second. I'd suggest to you that our goal today is to have you take this definition of critical thinking and look at these 4 terms and apply your critical thinking skills so that we can improve gut health, reduce chronic disease burden, and in so doing, have overall improvement in wellness and well-being. So to improve critical thinking, we need to first look at a bunch of information that we would have and take key terms. So I've picked out 4 terms from today's presentation and say we need to see where we are in terms of bringing distinctions, understanding the terms. That's defining the terms, and then returning to those definitions when we go through the whole process and coming up with a more nuanced definition. So one of the things that's important for critical thinking is the ability to look at the information and to begin to define it and look for distinctions in the various terms that you're working with. The second is then to consider whether or not the terms, that information, is part of a bigger picture, so part, or is it the whole picture? So for example, after we define dietary diversity or dietary fiber, is dietary fiber a part of dietary diversity, or is dietary diversity a way to look at dietary fiber? And that's the larger piece. You know, what is that? And then relationships. So always looking at the unstructured information for relationships. So I put 4 terms here. How are these terms related to one another? And finally, that 4th piece of the Cabrera model for improving critical thinking, perspectives. So that means, well, you go through and you define, you look for relationships, you look for whole structures within the terms, and then you turn to the literature, or you turn to a colleague and you say, this is what I think Henry's going to talk about, or this is what I think he said. And you get perspectives from your colleagues and from the literature, and then you return to these terms and to this process, and you repeat it until you think you synthesized the critical elements of how to improve human health through dietary diversity, dietary fiber, improving gut health, and maybe reducing the prevalence of obesity. So enough on that topic, but that's what critical, and succinctly, that's what critical thinking is all about. And let's turn to now, I wanted, in the remaining time that we have, consider giving you I would like you to consider that I'm going to provide you with, in your mind's eye, a large amount of unstructured information. And what I challenge you to do is return to that critical thinking slide and to think about that unstructured information and how you would structure it to improve human health and to improve the health of your clients and the profound impact of the things that you do with your clients in the clinic. What's gut health? To make it simple, in my laboratory, I work with histologists and pathologists. And if I say healthy gut, which is down at the bottom, this series of photomicrographs versus the unhealthy gut, which is represented here, just like boom, boom, boom. What is it? If a picture's worth 1,000 words, and if this is more healthy than this, tall in the intestine. The intestine looks healthy when you have tall columnar cells. Do the contrast in your mind. When those cells are full of the blue staining material is mucus that can be spilled out onto the intestinal lining and protect it. So mucus filled tall columnar cells, and as you know, the intestinal cells, they're always reproducing, so they need to replicate to replace the lost cells. And so from a pathologist point of view, where the proliferating cells occur, this structure is called a crypt, and the cells in a healthier gut, the cells that are replicating to provide the replacement cells for those that are sloughed off in the lumen always stay at the bottom. Look at the unhealthy cells where the zone of proliferation is extended way up into the crypt. That's in a nutshell some aspects of a healthy gut. And if you don't have a healthy gut, we refer to that as gut dysbiosis. And there's tremendous excitement in the medical community today, and for the past few years, in recognizing that so many different diseases that we hear commonly discussed, that you as dietitians are asked to counsel your clients about, and that to suggest a causal relationship between an unhealthy gut and these diseases. And I'm going to drill down on that, going deeper from our critical thinking point of view into 2 disease areas, cancer and cardiometabolic diseases. Recall, critical thinking is about understanding relationships, and I'm going to explore with you at a population level 4 chronic diseases and say, right now, before I go over this slide, are they interrelated? And I'm going to tell you the bottom line now. Yes, both the population data and the molecular data teach us that 4 diseases that several decades ago we thought were unrelated to one another are highly interrelated. Obesity, type 2 diabetes, heart disease, and cancer. This data is population data from the Centers for Disease Control for a single year, and it's through disease prevalence or mortality slides from 2008. So you could go and see what you think about this experiment. I repeated this experiment in 2018, and the relationships I'm about to discuss hold. And I'm just going to focus you on two areas. This could be correlation, not causation, but the molecular data suggests that there is a causal basis for what I'm explaining. Obesity, prevalence in an area like where I live in Colorado, low versus an area in this area in the south, that coloration, high prevalence. Type 2 diabetes, low prevalence, high prevalence. Death from cardiovascular disease. Different group in CDC made up the maps, so they use different coloration. But if you looked at the figure legends, low prevalence, extremely high prevalence. Cancers, again, a different group in CDC. This coloration pattern in the area that had low obesity, low type 2 diabetes, low cardiovascular disease mortality. This is death from cancer, low, extremely high. So what I suggest to you, if we can do something for one of these diseases, we're improving the health and well-being of our clients for all of the diseases. And I represent that in this relationship, or in this Venn diagram. There are 4 interrelated diseases, and if you want to know more, certainly contact me. And the remainder of the talk, I want to present evidence suggests that improved gut health through a particular type of food, which in my judgment is neglected on the dinner plates, breakfast, lunch, snack, and dinner plates of all Americans, that in fact a focus on pulse consumption can change the nature of the chronic disease burden that are associated with these 4 diseases, which cause 60 to 70% of the global mortality. Depends on what area of the world you're looking at. 67% of global mortality and per annum is based on is due to these 4 chronic diseases. I like to transition, and relative to a healthy diet, I'd like you to be thinking about, so what's that elevator pitch that comes to mind? And for me, it's always mom. My mom said, variety and moderation are the key in all aspects of lifestyle to health and happiness. So I say to you, mom was right, but what the heck did she mean, especially when it comes to eat a diverse diet? And I've thought about this question since probably 1985, and did a clinical trial on the concepts presented in this evolutionary tree of plant-based foods, which my laboratory developed and published in the late 90s. And we just recently resurfaced this whole concept working with colleagues around the world, and published again about a week ago in the journal Nutrients. So if you're interested in the evolutionary tree of plant-based foods, it's recently been published and updated. The tree's been updated and published. What's the bottom line behind this? So if you want to guide individuals to a diverse selection of plant foods, we suggest that you use the science of pharmacognosy, and within pharmacognosy is an area called chemotaxonomy, which says from an evolutionary perspective, and so this takes all the foods we commonly eat, puts them on an evolutionary tree, and it suggests that foods that are in the same limb, on the same branches of the tree, have a greater probability of having similar chemical components than foods in different parts of the tree, whether it be on limbs or branches. And we have come up with a strategy by which to determine the botanical dietary diversity index to gauge how diverse from a chemical perspective in an individual's intake of plant food is. So there's your framework, in my judgment, for better understanding the diversity of a whole food-based diet. But I'd suggest to you, relative to our topic today, that while most folks will say, well, if you want to increase dietary fiber, you should look over at this part of the tree to the cereal grains. And I would suggest to you, no. As critical thinkers, as folks thinking outside the box, that instead of focusing over here, we should focus here on Fabaceae, legumaceae. And I'll explain why in the next couple slides. In Fabaceae, legumaceae, legumes is what we refer to them. There are thousands. It's a very big botanical family. There are hundreds of edible legumes, but from a global perspective, there are 9 major legumes that individuals consume. And I suggest to you, in terms of critical thinking and particularly distinctions, that we as nutritionists and dietitians do not do a proper job to understanding the nuanced definitions that we should apply to legumes in general, and where pulses sit within this category of legumes. So the basic way to think about this, there are non-oilseed legumes and oilseed legumes. When we say legumes, I think many people's mind primarily go to peanut and soybean. Higher in fiber, higher in fat, and lower in fiber than non-oilseed legumes, which are obviously lower in fat in this classification, higher in fiber. And for many individuals, they don't recognize that there are 2 categories of non-oilseed legumes: pulses, which are the dry, mature seeds of the grain legumes, and there's 2 dominantly that are picked before they become mature. So these pulses give rise to undried legumes that are widely consumed: snap bean and snap pea, that are related to the pulses and just picked at an earlier stage than the pulses which are harvested for the dried mature seed. And of those pulses, there are 5 types that are predominantly eaten in the world: chickpea, cowpea, dry pea, dry bean, dry pea, and lentil. Oh, Henry, you're making a big deal out of nothing. They're all created equal. We just published on this 2 weeks ago in Nutrients, the journal Nutrients. And I suggest to you, again, thinking out of the box, thinking critically, and knowing that obesity is the gateway disease for type 2 diabetes, heart disease, and cancer, that we should relook at the way that we examine food composition data, and through that lens, ask the question, are all legumes created equal? I have for over a decade run a weight control clinic in breast cancer survivors. We are highly successful. And when we develop cuisines, not diets, but cuisines for weight control, we look at food composition data, we look at all the various guidelines, and we say, let's think in terms of 100-calorie portions. And so I'd like to put to the test, if all legumes are created equal and pulses are no different than the other types of legumes I've mentioned, then you should see no differences on a 100-calorie portion, edible portion, 100 calorie. And I suggest, and you can study these tables, which are going to be available in the PDFs that Barbara mentioned are available. Look at serving size for 100 calories. Look at the level of protein, lipid, and dietary fiber. And folks, as you study this, you can begin to see that pulses are really unique in being high fiber, high protein, low fat, and at a reasonable serving size relative to some of the other legumes in terms of providing, in particular, fiber and protein. The U.S. dietary guidelines for 2020 to 2025 were recently published. And in those dietary guidelines, if you don't eat a lot of pulses are like another vegetables, one way that you could interpret the guideline information. So, critical thinkers that you are, 100-calorie edible portion. Dry bean as an example of the various pulses I mentioned previously. I picked dry bean because of all the pulses, that is the one that is most predominantly consumed in the United States. And look at the serving size, look at the protein, and look at the fiber level. And it is very difficult for me to agree that all pulses are created equal. And we got a very long list of vegetables. We picked several representative. Something unique about the pulses. In fact, what we're seeing is 1-to-1 ratio of fiber to protein in pulses that you don't see in these other vegetables. And look at the serving sizes required per 100 calories to get various amounts of fiber or protein. Oh, wait a second. Henry, give us the boat. Pulses are just a meat alternative. And all other things are equal when you consume a pulse versus chicken or eggs or beef or salmon. And I'd simply say again, look at approximate serving size, the amount of protein, lipid in particular, and fiber. How can we say that pulse protein as a protein or a meat alternative is equivalent to these other sources, albeit they important, of protein in the diet? I think in a critical thinking world of nuanced understanding, you need to conclude that they are different, and that we would argue that pulses are unique in providing not only quality protein without fat, especially in an obesogenic environment, but high amounts of protein, dietary fiber. Oh, Henry, but they're so bland. So somebody says, oh, they're so bland. They'd probably be thinking a picture like this. And it's fruits and vegetables. We can get our clients interested in that because they're beautiful. And I say, wait a second. You don't understand the beautiful variety of pulse cultivars, such as dry bean, that are available from around the world. And one of my colleagues, Karen Siki, who is at Michigan State University, is the source of this beautiful picture. And if you want to know more about the wealth of opportunity to have beautiful cuisines using pulses from various parts of the world, you should talk to Dr. Siki about that. So I would not buy the argument that they're bland. We'll talk more about that in just a second. Oops, let me make sure. There we go. But Henry, they're just too much of a problem. And so here we have listed, when I listen to my colleagues, and I work with dietitians, love to work with dietitians, and they say, Henry, you know, it's just not practical. There's the taste issues. I work with, had the pleasure of working with master chefs in the United States, and they say, oh, contraire, Henry, pulses, you give us pulses and we can create any cuisine of the world using pulses. It's just about knowing how to use them. So taste, they tell me taste is not an issue. Cooking time, well, three categories of pulses. There aren't issues with cooking time. For example, lentils cook about the same time as it takes to cook white rice. This is an example. And Dr. Siki, who I mentioned, is looking for a second ago, is looking to identify dry beans that cook very quickly, very uniformly. Oh, but okay, so we can't talk about it, but there's that gas flatulence thing. And we've published on this, and, and it turns out genetically, about 90% of the population are very good gas carbon dioxide metabolizers, maybe 10% are not. And maybe the 10% who are not, we hear more concerns about intestinal discomfort from I'm not going to say the noisy 10% for obvious reasons, but from people who don't have tolerance. But for the vast majority of people, I would argue, suggest that in fact, the flatulence associated with pulse consumption really is not that different than with other foods when they are not eaten in large amounts. And once people have a regular and appropriate level of pulse consumption in the diet, this is not an issue. Oh, but they have those anti-nutrients. And 2 points. The paleo diet folks will say, oh, you got to stay away from all grains and any kind of seed because of lectins. The truth of the matter is, when any of the cereal or pulse grains are properly prepared, that means soaked and cooked, the lectins are in essence rendered undetectable. What about those other anti-nutrients? And I've had a lot of discussions about anti-nutrients and pulses and other foods. And I would suggest to you, because I work on the microbiome, they're not anti-nutrients, they're prebiotics. So I would flip that argument around and say pulses don't have a lot of anti-nutrients. They are loaded with prebiotics. Allergies. If you look across all pulses, their allergenic determinants are known, and the population is generally very tolerant to them. You're always going to find some individuals that have sensitivity to epitopes on any protein. But if we develop increased pulse consumption carefully, folks, I got to tell you, the world's literature suggests that this is not something that we should be concerned about now. And if we properly introduce and have variety in the types of pulses consumed, it won't be a problem into the future. So I suggest to you, there is absolutely no reason not to see increased consumption of pulses relative to promoting human health. So you keep saying that, Henry. Let's drill down a little bit more. Why? Because pulses are, in my judgment, the richest whole food source of dietary fiber that is available to the consumer, and particularly to every consumer, at a reasonable price point. That's a huge advantage. In terms of understanding dietary fiber, and I mentioned whole foods, we can eat our pulses, whether they're used as an ingredient or as the whole food, as a whole food, and they have this rich array of chemicals. Dietary fiber is not a chemical. It's probably over 1,000 different chemical determinants, and pulses have a unique profile of components that appear to be gut healthy. So, nuanced understanding of dietary fiber. If we had time to go deeper, there would be many fascinating stories to share with you. But I'll only share a little of that in a minute. I want to continue this theme. I see dietary fiber as being such a, in 40 years as a doctoral nutritional professional working in the lab and in the clinic, I think people have given up on dietary fiber because the gap is too big. This is the amount of of dietary fiber that is recommended, 28 to 42 grams per day, 14 grams per 1,000 calories is where that comes from. This is the amount that most Americans eat. 95% of the Americans fail to get adequate dietary fiber, and they fail by more than 50%, 50 to 70%. That is unacceptable. But many people, I think, say it's just insurmountable and take a supplement. And I'd suggest to you, you will not get the health benefit out of any supplemental source of fibers available. Whole foods is the way to go. But Henry, nobody does that. And I'd say that's just not true. If you go to the NHANES data, or from either United States, here's the reference, or from Canada, there are high pulse consumers. There's high pulse consumer. Typical consumption in the United States or Canada is 10 grams per day. Here are people that eating close to 300 grams per day. Look at their dietary fiber. There is no fiber gap in high pulse consumers, everything else being the same. So people do it. It's not undoable. People do it every day. Henry, help us understand, are all pulses created equal? No. That's why I suggest that beans are very important, as are chickpea, dry pea, and lentil. I now have cowpea data that's not shown on this slide. But this is a high-fat, pulseless, obesogenic diet. Here's what many people say, oh, it's a low-fat, less obesogenic diet, no pulses. Here is a list of microbes from the anaerobic compartment of the intestine. And what you can see is how differently various micropopulations respond to the inclusion or exclusion of pulses from the diet. So is there a relationship between pulse consumption and its impact on the composition of the gut microbiome? And the answer is absolutely. But that's not enough. A healthy gut, who cares? Well, I suggest that the data I've already shown you says we all should care. But those chronic diseases, Henry, help us understand that. So I'd like to point you to a systematic review and meta-analysis done in 2017. There's been a subsequent one done in 2019, including an additional study. The weight of evidence suggests that increased pulse consumption is associated with a reduction in obesity, type 2 diabetes, heart disease, and cancer. In population studies, median intake in those studies, 132 grams per day. And as I showed you from the previous slide, and NHANES suggests that there are people who eat a lot more than that, and my guess is they'd even be better protected. But my laboratory, that's this case in point. We say we take clinical data such as this, and we take it into the laboratory and see if we can deconstruct and understand why we're seeing effects in the clinic using preclinical models. And so I was attracted to the results of the meta-analysis, and I said, can I reconstruct, using pulse-based diets or not, the effects in terms of weight control? So initially I chose a rat model of dietary induced obesity, where the rats are genetically sensitive to becoming obese or resistant to becoming obese, but he did something very special. All the animals consumed the same amount of food, such that at the end of the study, the animals that were control or being fed, whether they be obesity sensitive or obesity resistant, had the same body weights, but we looked at body fat. And a lot of people think, and I don't necessarily agree with this, but that the visceral fat is where the action is in terms of metabolic disease. Certainly important, but not the only place we should be looking. But in the obesity sensitive animals, there was same body weight, a difference of 28% in the amount of visceral fat, in the bean versus control. And some people say, okay, that's great if you're overweight. For the resistant animals, they were even more responsive to the effects, the anti-obesogenic effects of bean, with a 43% reduction in obesity. It's all about dose. This is an unpublished study from my laboratory. We moved because we understand the importance of multiple preclinical models, different species, to inform our understanding, to know if it's likely to be translatable to people. That's why we use multiple models. So we moved to a very widely studied mouse model of dietary induced obesity. And we did a bean dose response, bean being the lead pulse that we work with, in female or male animals. And holy smoke, knocked my socks off, because we incorporated bean at a level of protein from bean of 17, 35 or 70% of dietary protein from a bean source. Think about this. You know, many vegans, 100% of their dietary protein comes from plant-based sources. So the argument that this data just is not translatable, it doesn't have any weight. These are well within demonstrated human norms in terms of sourcing dietary protein. Look at what we found. This is the amount of fat in these animals adjusted for the size of the animal. So it's like body mass index. Visceral and subcutaneous fat were dose responsibly reduced in bean-fed animals. And the female animals were more responsive than the male animals. So for those of you who worry about body weight and or the female women, my goodness, this is just good news wrapped up it with a bow. Lose it or use it. That's what I always say. You got to use the information I'm providing today 7 times in 10 days. So have lots of discussion with your colleagues. How would you take this information? How do you translate what I just showed you to be working in the animals to people? Let's work the numbers. If the average recommended intake of protein is 60 to 70 grams per day, I'm a rounder. I do things on the back of the envelope. So I say 70% of this number is about 49 grams of protein per day. If 49 grams of protein were to come from bean, that would be 2.3 cups of cooked bean, 700 calories. That's 49 grams of fiber, folks. The dietary fiber gap is crushed. Kind of bring it to a closure here. Beans and other pulses. They have culinary versatility. We published, this is from a paper I published with Chelsea Dittinger in 2020 in the journal Nutrients again, during the pandemic when people were buying a lot of pulses. You as a critical thinker, wanting to increase the opportunity for your clients to have health benefits from pulse consumption. They have culinary versatility. I've shared with you the Master Chef story. You can do anything, any flavor, texture, anything that your client wants can be had from pulses. Some of your your clients may be millennials in particular. They are probably one of the most sustainable crops in terms of improving the planet, improving the health of people, and having people be able to make an equitable, a just profit based on a culinary versatile food that promotes human health. Why we don't eat more pulses, it just always makes me scratch my head. And that's because we are not critically thinking as a team about how we can get this done. And that's why I'm so excited to be chatting with you today, because I think as a team, we can get this done. So what are the takeaways from my presentation? People want you as dietitians want to recommend a healthy diet, a high quality diet. I suggest to you it's a diverse diet, and think about the tree. I suggest to you that in thinking about the tree, that you can construct menus and recipes to develop a cuisine for your clients that have high botanical diversity, and that they should be rich in pulses as a source of protein and fiber. The dietary fiber gap, it doesn't need to be. It is simply because we haven't taken advantage of the most important category of foods to address that gap. And if we fix the dietary fiber gap, we will get a happy gut, a happy mind, mental health, and a happy body, physical health. Dose matters. So this whole thing, I like a half a cup a week. Come on, people. I'm saying, 2 to 3 cups a day. That's doable. And we crush the fiber gap. It's easy, safe, and affordable. And remember, I like it. It's really important. It's a delectable cuisine. So my bottom line slide. Common bean and other pulses. They are the premier, authentic, low fiber, low fat, high fiber, high protein, anti-obesogenic foods. Non-GMO, gluten-free, no cholesterol, culinary flexibility. You can eat them as a whole food or a whole food powder. Any flavor, cuisine, texture, crunch, I suggest to you. And the way you can convey it to your clients. It's the secret of the ancients rediscovered. Now, my last slide, you got this in 2 slides in your PDF, are references for this talk, but I did the references a little differently. And let me just tell you a little backstory. So if you start from the bottom of the reference list and work up, you'll see the history of my laboratory's involvement in studying common bean and other pulses. And I thought that would be a more interesting way to present the literature that I've discussed today than simply providing a couple cherry-picked references. So I hope you enjoy. That's yet another way to think about critical thinking and how to learn from material you would normally say, so what? So let me go back to my bottom line slide. And at this point, I'm going to return the presentation to Barbara and see if, in fact, you folks have any questions.
Wonderful, 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 wonderful presentation, Dr. Thompson. Thank you so much for giving us such timely advice for crushing the dietary fiber gap. We do have a few questions for you. First question, what about the supposed anti-nutrient, or in your case, you reference prebiotics, effect such as phytic acid that can bind to iron, zinc, calcium, magnesium, and potassium? Is this an issue with absorption?
So I would submit to you this whole concept, the terminology of anti-nutrients, and it's being slowly addressed now by some leaders in the field, is a term from the 50s and 60s that we need to revisit. And I think the way my mind thinks about this critically right now is that you need to provide a nutrient stream, not only to the small intestine for uptake, but to the large intestine, because in fact, those minerals that we're talking about are also required by the gut microbes that we would like to nourish. So the way I've rethought about this is if in fact these agents which so phytate or oxalate cause a redistribution of nutrients in terms of the amount that's presented in various parts of the intestinal system, and that if you look at the new dietary guidance, the nutrients that you've mentioned that people worry about are not nutrients of public health concern in the United States, generally speaking. Even iron is not currently looked at as a nutrient of public health concern, which might be surprising to you, but take a look at the dietary guidelines. So that's why I suggest that I think it's time to rethink our use of terminology, and that we really want to think of beans as being prebiotic not only in their fiber content, but also in their content of things that at one point in time, historically, we called anti-nutrients.
Great, great. Thank you very much. With clients, would it be beneficial to have them begin with just 1 cup? How do you start to introduce them to get to that 3 cups a day?
I think as it is with all, if for most folks, you can presume that they're not eating many pulse-based foods. And so I think it is always wise to have people increase, not just like that, but slowly. And so you start with a quarter cup a day, a couple days of that, you come up with menu and recipe guidance that's a half cup. And you can do it in quarter or half cup increments until they have had an opportunity to have an adaptation to these wonderful prebiotic effects of pulses, such that they have satiety and a feeling of wellness in the absence of any of the classic discomfort reports that we have that have in the past been associated with consumption of beans and other pulses.
Great, thank you. This is a question related to those CDC map charts, but you're seeing that for the US, but what do we know about the level of chronic diseases in countries that do have high pulse consumption?
Yeah, so that's a great question. So the number of countries that have high pulse consumption tend to be in areas of the world that are less socioeconomically well off. Unfortunately, that's why pulses have been dubbed poor man's food, which is a misnomer because it's really smart man's food when you understand their health benefits. If you try to given all the issues with the factors contribute to chronic disease, when you try to disentangle pulse consumption from the many sources of chronic disease and say, look, lower chronic disease, higher pulse consumption. From a scientist's point of view, say that is a tough direct causality line, because there's so many intervening situations that would make us hesitate by saying forcefully high pulse consumption any place in the world, low chronic diseases, and there's a causal relationship. We can't say that with confidence, but we can say in the areas of the world that are high pulse consuming, they tend to have lower levels of these chronic diseases. But to say that those two are directly related, that just wouldn't be scientifically correct. It's a very complicated question. So thank you for it.
Thank you. Do you know, where can we get tasty recipes and nutrient information? Do you have a favorite source?
Well, I think there are many favorite sources, but let me tell you, since this is a group of professionals from Michigan, the Michigan Bean Council and several groups within Michigan have wonderful recipe resources that are available to anybody. So I would suggest look at home first, and then if you need even more wonderful ideas, there are recipes available at multiple sites, including our own, that give you a sense of the culinary opportunities of pulses present. But I think folks should go to the website of the folks that the Michigan Bean Commission, because they're going to right there start with a wonderful repertoire of ideas about how to use pulses in large amounts on a daily basis. And I didn't say it before, but I should say this now. What we are all striving for is to have pulse consumption routinized, such that it's like brushing your teeth. You don't think twice about the importance of pulses and where you're going to have them in your diet throughout the day.
Great, great. Well, on that question, Doctor, I don't think we can get any better. So I'm going to end the questions right now just because of time. But once again, the Michigan Bean Commission would like to thank Dr. Thompson for sharing his expertise and his enthusiasm. Just as a brief review, today's webinar covered what pulses are and how to properly categorize them, the health benefits of pulse consumption, and the critical thinking approach to develop workable solutions to health improvement via increased health consumption. So a few reminders about today's webinar. The Continuing Education Credit Certificate is available to download at the MichiganBeanCommission.com website under the Health Professionals section, and a recording of today's exciting and invigorating webinar will also be available to download shortly at the same location. For any questions about the webinars, please use our email of mbc.beanacademy@gmail.com. And we are so glad you are taking time to join us today. And we'd like to invite you to join us for our next webinar, who just so happens, Dr. Thompson, to be Karen Chichi, who you had mentioned several times. She's going to be talking about the anatomy of the bean, dry bean breeding and production for consumer acceptance. So we hope you can join us for that. That will be on June 17th, and registration information is available right now on our website. So thank you again for sharing your day with us. We'd like you to stay on the line for just a few moments for a very brief survey, just to tell us about how we are doing. And again, thank you for joining us for building a foundation for closing the dietary fiber gap, improving gut health through a diverse diet. Thank you to the audience, and thank you again, Dr. Thompson.
You're welcome.